Hello, everyone. Welcome to our webinar on arthritis and the gut. I am Martin Lau, Dietitian and Services Development Manager for Arthritis Action. Our expert speaker this morning is Dr. Wendy Holden,
Good morning.
Arthritis Action's medical advisor. I must say this webinar is one of our most popular topic with over 300 people registered. Now, I want to put out a little housekeeping message. If you would like to ask any questions at any point during the webinar, please make use of the Q&A box below. The speakers will answer as many questions as possible at the end of the webinar. We will endeavor to answer all the questions live, but if we do not have time to answer your questions in our allocated time, which is often the case, we will answer them via email within 2 to 3 days after the webinar. Please be patient with us. Finally, I would like to remind you that this webinar is not intended to be a substitute for medical advice. Always seek guidance from your doctor or other qualified healthcare professionals with any questions that you may have regarding your own medical condition. Hello, Wendy.
Good morning. How good to see so many people doing this. I think it just is a testament to the fact that we're all a bit slightly obsessed with our bowels, aren't we? Which is not necessarily a bad thing, but
No, not a bad thing at all.
yeah.
Well,
Mm.
thank you so much for joining me today. I am sure you don't need any further introductions, but for those who don't know who you are, is it possible to just give a brief
Yeah, hi,
bio?
I am Wendy Holden. Hi, I'm a rheumatologist and I'm Arthritis Action's medical advisor.
Fantastic. What have you been up to lately?
So I've been researching all about the gut, Martin, which is a fascinating subject. And the
It
more you
is.
read, I can say the more you read, the more confused you get. So
Oh,
I'm
yeah.
also
Oh,
I
same
am
here.
also I am also confused, but I can tell you for sure that the gut and the joints are connected for sure. We know it's something we
Very
do know.
much so. Very much so. Oh, that's fantastic. Thank you. In the last few years, gut bacteria have been receiving a lot of exposure. I remember learning about them at university over 2 decades ago, and to now, knowing their parts to play in chronic diseases. And by the way, our understanding is only at the tip of the iceberg. I'm sure that this is something echo with what you just said earlier, Wendy. So, why is our gut so important to our health, Wendy?
Well, we literally are what we eat, and that concept actually came from a French lawyer in the 1800s who wrote a book about basically tell me what you eat, and I will tell you what you are. So we are really the food that we eat. So our gut obviously it helps us digest food, so it gives us energy. It protects us from eating poison. So if we eat poison, we will vomit. So it will protect us from dangers. It protects us from poisonous bacteria as well. It will protect us from harmful bacteria. It helps us to detoxify food. Obviously, that's the role of the liver. It processes vitamins. And in terms of this talk, it is vital in terms of communicating with the brain, the immune system, and the joints. And all of these systems talk to each other. So if our gut goes wrong, frankly, everything goes wrong, and often vice versa. If our brain goes wrong, our guts often go wrong. So all of these systems talk to each other all the time.
Yeah, they talk about this gut-brain axis, isn't it?
Exactly, and the gut joint axis as well that we're going to talk about.
Yes, yes. We have heard the term microbiome. Now,
Hmm.
what exactly is that, please?
So the microbiome refers not just to the gut, but it refers to all of the bacteria and microorganisms. These are tiny things that we can't see: bacteria, viruses, fungi that cover us. Basically, they're in our skin, they're in our mouth, they're on any surface really that comes in contact with the outside world. And in terms of the gut microbiome is all the bacteria and the fungi and the viruses that live inside our gut. So I have got a little slide to show you. I can't do screen sharing there, Martin. So let me see if I can work out how to do that. Are you able to turn that on for me?
Okay.
Let me ramble while we're trying to fix
I
that
think it's
solution, while
been
we're trying to
fixed.
fix that problem. That's fixed. Thank you, Martin. It worked just now. Okay. Okay, so can you see my screen there? So this shows a picture of the gut. Hope you can see that. Does that look all right, Martin? Yeah.
Yep.
So what we've got, the gut means lots of different things to lots of people, but to medical people, the gut it means this really, the intestines. And the gut comprises three main areas really. There's other bits and bobs, but three important areas. So first of all, there's the stomach, and that is where the food, but the first part of the gut that the food reaches, and that's the place where the food is mashed up and there's lots of acid that kills harmful things in food, and that's the pink on the picture there. So the next part of the bowel is the small intestine, and that's the bit that looks like a curly hose pipe in the middle, and that's the part where all the food is digested and the nutrients are extracted. And we used to think that that was really all there was to the gut, and that was the only important bit, and that you could live perfectly well without the colon, which you can live without a colon, which is the large intestine, the blue on the picture there. However, there is a lot going on in the large bowel or the colon, and this is what we really mean by the intestines for most people. And this is where the microbiome lives. So most of the rest of the gut doesn't have any bacteria in it. There may be a few, but there aren't many. But most of the gut microbiome lives in the blue area there. And there are literally trillions of bacteria there. They comprise quite a large part of our body weight, and there are perhaps 5,000 or more species of different bacteria in there. So it's like the most unimaginable garden, really, with thousands and thousands and thousands of species, many of which we don't really know anything about at all. Each person has a completely different species or garden, if you like, in terms of the number of bacteria that they have, and that would include even identical twins will have different bacteria in their bowel. The bowel composition is really interesting because it varies with time. So a newborn baby will have a very different bowel composition to an adult, often depending on how they are born, whether they are born in the traditional way or whether they are born by cesarean. Bowel composition, the composition of the microbiome depends on gender. So there's very much a hormonal difference. Illness and medication, of course, can affect the gut microbiome as well. And of course, what we eat will determine the composition of our microbiome at all. Now, a healthy microbiome will generate anti-inflammatory substances, in particular substances called fatty acids, in particular one called butyrate. So that's
The
one
short
thing that
chain
we
one,
may
isn't
go.
it?
Yeah, exactly. So a healthy microbiome will generate just like a garden, will be in harmony. So that's it. That is the microbiome. Very
Oh, yes.
complex. No one understands this, in spite of what you might hear from others.
Oh, Wendy, could you put the your presentation in the presented mode
Sorry, I'm
for your
back
next
now.
one?
Thank you.
And yeah, now this is quite interesting because there is a term that I often hear, but not kind of understanding it fully. I wonder whether you could shed some light on. It's something called the gut dysbiosis. Is it possible that you could tell us a little bit more, please?
Yeah. So if you think of the microbiome as a beautiful garden, the most beautiful garden that you've ever seen, everything is in harmony in this garden. There's bees and there's flowers and there's seeds and everything looks rosy. So that's a microbiome in the gut, in harmony, if you like. Now, if you neglect that garden, what will happen very quickly is before you know it, your garden will be full of thistles and nettles and, like mine, brambles. And in terms of the gut, that is what we would call gut dysbiosis. So something has gone wrong with the overall harmony of the bacteria in there. So if we don't look after our gut, the wrong bacteria will flourish, or if we eat the wrong food, or if we are unwell, we get what you call gut dysbiosis. So that's the wrong balance. So it's either too many of the wrong bacteria or not enough of the good bacteria amounts to the same thing. And now gut dysbiosis can lead to all kinds of things. It has been associated with leaky bowel, what we call leaky bowel. So where the gut lining is
More
damaged.
permeable.
Yeah, it becomes more permeable. Exactly. And that can be obviously lead to things like inflammatory bowel disease. So things like Crohn's and colitis are very strongly connected with gut dysbiosis. We don't really know which one came first with that, but they're certainly connected. In irritable bowel syndrome, similarly. Gut dysbiosis is linked with many conditions, including type 2 diabetes, cardiovascular disease, obesity in terms of the brain, Alzheimer's disease, Parkinson's disease, anxiety and depression, MS. You name it, it's connected there neurologically. And in terms of our talk, very importantly, inflammatory arthritis such as rheumatoid, psoriatic arthritis, spondyloarthropathy, and definitely osteoarthritis as well. So gut dysbiosis is connected really with all kinds of illnesses.
That sort of leads to, what do we know about the relationship between arthritis and the gut microbiome? And I think you probably
Yeah, this
answer
is a
most of it,
yeah.
but we kind of like, when the research start shedding a little bit more light, we tend to know this a little bit more, don't we, Wendy?
Yeah, absolutely. This is an emerging topic, and there is lots of research money going into this topic at the moment. So I'm just going to see if I can just show you another slide here that will help, hopefully, with this this aspect. So this is just a picture of
Wendy,
uh,
could you play the your presentation on the presenting mode, please?
Martin. There we go. Like that. Sorry. So this is
Oh,
a pic.
fantastic.
That works.
Thank
Sorry.
you.
So this is on the left is a picture of a normal colon, which looks nice and pink. The red there is the blood vessels, nice and healthy, nice and shiny. This picture on the right is colitis, an inflammatory condition of the colon. And you can imagine that this bowel is a very leaky bowel, and what goes into the bowel will be leaking into the rest of the body, and that is not a helpful situation. Now, this is what Martin was talking about, the gut joint axis. So on the left of the picture here, we've got the healthy microbiome, a schematic of what the gut microbiome might look like. The lining of the gut is covered by what we call a gut biofilm, which is basically a kind of slime that protects the cells of the gut. Here's the cells of the lining of the gut. And then inside the gut, what we've got is the immune system here. And to the right of that is the blood supply to the bowel. And then we've got a healthy joint here. So everything is in harmony here. Normal gut, normal lining, normal blood, immune system, nice and quiet, happy joints. Now, what can happen if the gut goes wrong, if there is dysbiosis on the left here? This slimy layer gets damaged, and this is where we get a leaky bowel. So these bacteria then will start talking to the immune cells inside here. And then once these immune cells get activated, they will then start talking to the cells in the blood, in particular the white cells that are responsible for immune activation. And then that can subsequently lead to inflammation in the joint. So Claudia Mori, whose name I've put down the bottom there, has written a very nice introduction to this. So thank you to her. I've stolen her slides there, but she's written some nice studies on this about the gut and the joints. So we know for sure that I'll stop my sharing now. We know for sure that the gut microbiome is changed in rheumatoid arthritis, psoriatic arthritis, spondyloarthropathy, and indeed osteoarthritis. But the results from studies are inconsistent. So what the scientists have done is they've taken hundreds of people who are normal people, hundreds of people with inflammatory arthritis, and they've looked at all of these gut bacteria that people have got. Now, you will understand that if there are thousands of bacteria, it's very hard to categorize all these different bacteria and quantify them. Some of them are not even identified yet.
Culturable as well, yeah.
Exactly. Some of them don't even have names. However, they have shown patterns of abnormal bacteria in people with rheumatoid arthritis, and there's a couple of names. I mean, they've all got very complicated Latin names. But for example, there's a species called Prevotella that is
Oh,
common in
yes.
rheumatoid arthritis,
Yes.
and some species called Lactobacillus, and we're going to talk about those because those are also good bacteria. So there
Okay.
presumably are good Lactobacillus, and there are bad Lactobacillus as
Yes.
well. So again, the understanding of these things is not really well categorized. So we know that there is definitely a problem with the microbiome in rheumatoid arthritis, but it is inconsistent. When they look at mouse models of arthritis, again, and these are again artificial models where mouse are rendered, their guts are rendered sterile, in other words, clear of bacteria with various antibiotics, they will often go on to develop inflammatory arthritis. But clearly, a mouse is not a human, so you can't necessarily translate those mouse studies into human research. So we know that the microbiome goes wrong. Interestingly, some of you watching may well be taking methotrexate, and methotrexate has its own effects on the gut, as you probably will know. But interestingly, it can restore the microbiome in people with rheumatoid arthritis. So that's a very interesting finding.
Wendy, guess what?
Yeah,
I have actually read somewhere that, that as you know, there are some patients who are responsive to methotrexate and some that who don't, the
yeah,
non-responders. And this researcher over at the University of California, she mentioned that because for people who do not respond to methotrexate, it's because their microbiomes metabolize the drug very quickly, so that the drug itself cannot work as magic, and then that sort of like leads to a suggestion of maybe a microbial profiling within the inflammatory arthritis population, could be a way, for rheumatologists to select their arsenal. What do you think about that?
that is a really interesting point, Martin. I hadn't
Hmm,
that could well be true. And there's another interesting thing connected with that, which I wonder if that might be relevant, is that some people will respond to methotrexate
hmm.
for a while and then they stop. And if they switch to injectable methotrexate, then they start responding again. And I wonder if that could potentially
The
be
gut.
relevant, because obviously
Yeah.
then if it's going straight into their blood and missing out the bowel, then the bacteria are not metabolizing it,
Yes.
presumably. Yeah,
Yes.
that's very interesting, and that would be fantastic if you could tell who was going to respond and who wasn't going to respond, couldn't you? And that would dramatically speed up the process of helping people with arthritis.
And
Very
especially
interesting.
and especially methotrexate is the
Yeah,
first line
yeah.
medication, and I do know that a lot of patients tend to complain whether, why is it not working for me? Why is it always going to be this trial and error, looking at the dosage? But if we could sort of provide a way where it's definitely going to help them, I think that will save a lot of time.
I agree. I agree. That would be very useful. I just wanted to say something a little bit about osteoarthritis as well, and gut bacteria, which is it's basically a mouse study, so not necessarily applicable. But basically, what scientists have done in osteoarthritis is that they have fed mice unhealthy food. these mice become very, very big. And then what they've done is to injure their joints, in other words, to artificially replicate osteoarthritis. And what these mouse get is rapidly progressive osteoarthritis. So it's thought that there is a direct link there between diet potentially and joint damage in osteoarthritis. Then they've done an exciting thing, which we'll talk about later, which is they fed them some prebiotic foods and they develop less joint damage, which is interesting as well.
Wow, wow. Apart from medications, what other things that could oh, do apologize. What other things that could affect the gut microbiome? I do
Oh,
apologize about this.
well, exercise is very important. Exercise has been shown quite quickly, actually. So aerobic exercise, which doesn't have to be crazy going to the gym as we know, it could just be walking or doing gentle cycling, things like that, can definitely affect the microbiome. Stress, undoubtedly, feeling low or anxious can definitely affect the microbiome. And as I've already said, the microbiome, an altered microbiome is associated with these conditions. We don't really know which came first, but they are definitely related. What else? Sleep and the microbiome are connected as well, of course. And of course, all of these things are linked to chronic pain in addition. So everything is connected.
Right. I've heard that all the non-steroidal inflammatory agents could have could have a negative effect on our gut. Is there any sort of evidence regarding that?
Yeah, absolutely. Let me just talk to you a little bit about medication and the gut, because that's so important that we can't really ignore that one. So let's just show you a couple of slides about medication and the gut. So this little picture, can you see this picture on the bottom left here? So this
Oh,
is a
Wendy, you
picture.
may have to put it on presentation mode.
Sorry, there we go. There
Thank
we go.
you.
That's better. So sorry. So this picture on the bottom left is both of those pictures are abnormal guts, very, very red. It should be pink, and that is the effect of anti-inflammatories. They directly damage the surface of the gut. And the picture on the right, those very dark areas are areas where the anti-inflammatory is actually corroded through the gut and led to bleeding. So anti-inflammatories directly damage the lining of the gut and can contribute to inflammation and colitis. I mean, I've wondered about this and rheumatoid arthritis as well, because lots of people with rheumatoid arthritis or osteoarthritis obviously taking anti-inflammatories to help with the pain. And so that could, in the early stages, be contributing to an altered gut microbiome potentially as well. And I wonder if that's relevant also to why methotrexate doesn't work for some people. So anti-inflammatory is definitely bad for the gut. Many prescription medications have been shown to affect the gut microbiome, in particular codeine and other opioids. Omeprazole, which most people are taking when they're
Yeah.
taking anti-inflammatories as well. In addition, omeprazole is coated with lactose, and some people, obviously, many people are lactose tolerant, so that can affect the bowel, not directly affect the bowel lining, but obviously can cause diarrhea. Other drug coatings are linked with altered bowel microbiome as well, in particular polyethylene glycol, which Martin, is the active ingredient in macrogol, isn't it? Which is obviously
Yes.
a laxative. That's probably why it causes diarrhea. Now, the worst culprit, however, is antibiotics, and it's obvious why antibiotics are so bad. Antibiotics kill bacteria, and that means they kill gut bacteria as well. They kill harmful bacteria, but they also kill good bacteria. And so the first thing that you normally get 24 hours after taking antibiotics is diarrhea, because the good gut bacteria have been killed. And in particular, childhood antibiotics are thought to be a bad thing. So as our microbiome is developing, if we start to knock out certain subsets of that, then we may not be developing a healthy microbiome. And of course, there are antibiotics in food, in particular in meat. And this is a bit of an unknown and a slightly, not, I don't want to say secret conspiracy, but there are antibiotics are allowed in certain situations to be put into animals who are ill, and we can never be sure if our food is free of antibiotics if we don't know exactly where it has come from. So many people take this medication. I certainly do, and all of the things that I've starred there on that box of Gaviscon, which certainly helps with heartburn, are not very good for the gut microbiome. So a lot of these things are artificial sweeteners like aspartame and acesulfame, and those things have been shown to affect the gut microbiome in addition. So medication is a kind of double-edged sword, really, isn't it? You need it, but you have to bear in mind that it might not be helping us in the best way in terms of our bowel.
I guess that it just, looking at, when you have got a period that you need to be taking the medications, which are likely going to be, affecting your gut microbiome, you just, got to, protect yourself. I don't know whether protect is a good word, but you've got to, refurbish your gut microbiomes. I guess this is where the probiotic supplements can be rather helpful.
Yeah, exactly. And we're going to talk about that
Yes,
shortly, aren't
yeah,
we? We
yeah,
are.
we are. And then it is quite nicely tied into what can we do to improve our gut microbiome.
Yeah, absolutely. So one thing I wanted to say, Martin, is that hormones are an interesting thing that I touched on. And in women who have an early menopause, that is before the age of 40, the gut microbiome goes very, very badly wrong, and HRT has been shown to restore that. So in general, estrogen is a good thing for the gut microbiome, as being good for lots of other things too. So what can we do to improve our microbiome? So loads and loads of different things. And I think the first thing we should probably talk about is, well, other than avoiding drugs, that's if we possibly can, very important there. Lifestyle things. So in particular, healthy things like avoiding alcohol as much as possible and not smoking. Those are both pro-inflammatory things in terms of the gut microbiome. But let's talk about. We're going to talk about dietary fiber now, aren't we? Or
Oh,
roughage,
yes,
as it used to be
we
called
can't avoid that.
in my mum's day. Roughage. So, Martin, what is dietary fiber?
Right. Okay. So dietary fiber, it can be the resistant, carbohydrate that, as the word suggests, that they cannot be digested or absorbed in the body. And it's something that, unfortunately, in the modern days, we are eating less of. Now, in some ways, when we look at the national national diet and nutritional survey, we are seeing that in our population we're only managing around 19 grams of fiber on a daily basis, and this is in no way that is going to help to, number one, keeping our inside healthy, and number two, this is related to something that we are talking about, which is providing our gut microbiome the adequate substrate to be able to help us to further digest our food, so that is going to turn it into some of the really important byproduct like the short chain fatty acids. Now, we can hear what we see in even in sort of like in TV programs or different sort of advertisement talking about pre or probiotics, and I think this is really important for us to understand the differences between that. Now, when we look at the definition for prebiotics, and these are substances that providing food for our gut microbiome. Usually, it is the resistant carbohydrate that human being cannot digest. In contrast, when we look at probiotics, they are food or even supplements that could maintain or increase the number of our gut microflora. And I think, if we understand the two, then we'll be able to be, factor into, our food waste.
Okay, so there are different kinds of fiber, aren't there, Martin? So could you say a bit more about those? I've been a bit confused about the soluble fiber and the insoluble fiber.
Insoluble fiber is the one that I talked about, that it just can't be absorbed by our system. It then, our friends in our guts will be able to help. But the soluble ones, that is something that, can form like a, really thick paste. And then it
Mhm.
is something that we could sort of, eventually being absorbed into our system.
So how would you, so you basically what you're saying, I think, is that we should probably try and double the amount of fiber in our diet if we can. Is that right? So how
Definitely,
how
definitely.
can we how can we do that? Because it's not necessarily palatable or easy for some people to do that. So there's some simple things we can do.
Definitely. Just simply, if we look at the fiber content in 80 grams of white pasta, I'll just give you an example because I love pasta. Um, you you can find that, for that 80 gram, you only get about 2.6 grams of fiber in it. But in contrast, the same weight of whole grain pasta have got about 6.4 grams of fiber. And then if you look at buckwheat pasta, it's got even more, 7.2 grams. So, simply by changing the white version, or the more processed version, into the original form, you are going to, get more fiber into your system. And again, replace some of your breakfast cereal, for example, your cornflakes, to muesli, or even bran flakes, or even, porridge. You are going to get a little bit more fiber in there as well. Now, in particular, we often heard people, well, we often heard, the saying that, to have, five a day. A lot of us tend to take it quite literal, but, in the grand scheme of things, if we only going to have five a day, this is not going to have enough fiber, for us, on a daily basis. So in order for us to, get good amount of fiber, we need to aim for at least 8 or more of fruit and vegetable per day. In some ways, this is sort of like, coincide with what the Mediterranean diet often say, that you should have, more than, your five portions of your fruit and vegetable a day. And some Mediterranean country even have, like 10. Now that could be quite drastic, because, we got also need to, mold the nutrition plan to, our lifestyle. But if we can sort of like, remember that when the government mentioned about five a day, is not literal, just five of fruit and vegetable a day. It is actually a minimum of, five a day. So if you can sort of like increase your intake, slightly a little bit more. And I think the secret sauce is actually using a lot more pulses, also seeds and nuts. They can also help to increase your fiber content as well.
Mhm. And also that's brilliant, thank you. And it's not just about eating the same five a day or six a day, is it? It's having a variety there of of
Yes,
of, of fruit foods. Yeah.
you got to experiment with it.
Mm.
The more variety, the better it's going to be. And
Yeah.
and this is also, stipulated in the Eat Well plates, that, got to be, healthy, balanced, varied, foods. And, not no one food will contain all the nutrients that you need. So definitely experiment with some of the food that you eat.
Yeah,
um, you know,
absolutely. And
mm,
that kind of comes around to processed food, really, doesn't it? Because in general, a lot of processed food doesn't really have high levels of fiber in it, does it? So
because
I
it's
think
taken
maybe
away.
if we try to focus on having more fiber, then we will naturally move away from processed foods and sugar anyway. Would that be fair to
I
say?
think that is definitely fair to say, and with the understanding of the ultra processed food, that can cause cause more sort of health issues. We got to look at selecting food a little bit more diligently. In particular, I know quite a few TV doctors tend to say that oh, and then if you can't pronounce a particular ingredient, don't buy it. I wanted to say that I'm not for ultra processed foods here, but we also got to understand that in nutrition, there's certainly no black and white. We certainly no need to make this ultra processed food as villains, but understanding that by eating more of it, it is not going to be good for us. Now, I can only say that there are some good evidence looking at persistent pain. When we have more ultra processed food than normal, it can actually increase the severity of how we experience this pain. I mean,
Mm,
even though that pain on its own it should be looked at as a biopsychosocial phenomenon, but on what we can control from our nutrition, minimizing that is definitely going to be important. So don't fear them, because there will be a time where you have been working late, you needed something to stop the hunger. They can be useful, but at the same time, don't have it all the time. I think this is something it's going to be quite fair to say about the ultra processed food.
yeah, so I've just seen a question here, Martin, but from
Mm.
Marie. Just wanted to ask you this one on this topic. She asks, is sugar or white carbohydrates still continue to be considered to be inflammatory? And I wanted to ask you that question. So that's a question about, are certain foods bad? You've kind of answered that really already. Are certain foods good? So I think, yeah, just
I think
clarify that.
again we need to steer away from what is a good food, what is a bad food, because and ultimately all food can be helpful to your needs, but there's certainly going to be a bad dietary pattern that you can follow. Now, in terms of sugar, per se, they are not inflammatory as such, but eating more of is definitely going to set you up set the body up to be a little of a creating the chronic inflammation. Namely, it's associated with increase or increment of calories will lead to increment of body weight or body fat. And if we accumulate more body fat or more fat cells in our system, that is something that can drive our body into chronic inflammation. So if you are of normal body weight, having a sugar sweetened beverage is okay. But if you are carrying more body fat than you should, always remember that you are already has got chronic inflammation in your body. I normally say this analogy: you already got forest fire in your body. By adding more fire or adding more sources of fire in your system, definitely will not help, because then your immune system will start kicking in, and then you will feel the pain a little bit more consistent. But at the same time, if you are if you want to enjoy a little, or maybe we want to put a little bit of sugar in your coffee, that is not a problem at all. But
Yeah.
so, the amount makes the poison, put it this way.
Yeah, absolutely. I mean, we shouldn't be punishing ourselves all the time. We've got enough to be guilty about, haven't we, without thinking, oh dear, I just ate some sugar there or whatever. So it's about trying to move to less sugar and to less
Yes,
fiber and a more
definitely.
healthier
Yeah.
way of being, isn't it?
Mm.
But nothing is forbidden or punitive in any way with this, is
Rather
it?
than
Yeah,
avoid, limit, and
yeah.
also looking at your existing situation.
Yeah.
Because food ultimately, apart from satisfying your physiological needs, it also satisfies your social needs as well.
Yeah, absolutely. Okay, so now we've got loads of questions there, but
We have,
we can answer any that we can't
yeah,
manage to answer
and I
during the
think
thing. We'll answer them later.
yeah, but I think one thing that I would like to also mention is is the vitamin D connection as well.
Yeah,
Right, as you know, people living with inflammatory arthritis often to be found to be deficient in vitamin D. And sometimes, I always wonder, I don't know whether you share this with me, Wendy, is when somebody, we know that, how important vitamin D is in our system. But if somebody is a little bit deficient, would it actually cause our immune system not to work as well? And also, if our gut bacteria or gut microbiome tend to use vitamin D as well as our cells in our guts, if vitamin D is in a short supply, will it actually cause the arthritis worse? Or, but then again, when we supplement from clinical data, when we see that we supplement with vitamin D, it doesn't actually attenuate the pain, but are we actually doing anything positively? I don't think there are
yeah,
any
that's a good
study.
question. I mean,
Yeah.
many of us, when we are checked for our vitamin D
Mm.
levels, are low. So deficiency is really, really common in the UK. We don't get enough sun.
Yeah,
Sorry, I've got a lot of
absolutely.
sun in my room now. We don't get enough sun to be meaningful between September and May, even if we're outdoors all the time.
Yeah,
So
April time. Yeah.
many of us become low or deficient during the winter. So there is definitely a connection between vitamin D and the immune system. Most of the cells on our body can have vitamin D receptors, in particular muscle cells and bones, and not bone, but other cells in particular. But you're right, Martin, that if you supplement vitamin D, it doesn't necessarily help with pain, or it doesn't
Mm.
necessarily help with inflammation, but because we don't really understand that link there between vitamin D. But it is important that we keep our levels up, keep our levels up. So I would,
Yeah,
advocate that
definitely. Yeah.
everybody
Yeah.
should be taking a supplement, certainly through the winter, and some people all through the year.
And
Um,
also for the bone health,
but in terms
vitamin
of
D is vital.
in terms of bone health as well, and muscle strength.
Definitely.
Yeah,
Right.
I would agree with that.
Okay, I think we are going to stop our chat here, Wendy, because I know that we can talk about this, for hours
Yeah,
upon hours.
yeah.
But what I'm going to do is I am going to move on to answering some of the questions because I can see we have got quite a fair few of them.
We need to talk about prebiotics as well, Martin, don't we? Difference between prebiotics and probiotics. So there's some
Yes, I
confusion there.
yeah, I definitely mentioned briefly, but I'm going to talk about it again. Prebiotic, they are the substances that provide food for our gut microflora or microbiome, and usually it is resistant for us to digest. Probiotics are the food or supplements that could maintain or increase the number of our gut microflora. So, for example, caviar or yogurt. They are the probiotics because they contain different cultures. Or even when we look at some of the Yakult Actimels or even Activia, they provide a specific strain to help to flourish our our microbial community. In particular, when we're looking at the Yakult or Actimel, they are using Lactobacillus casei, which is one of the key bacteria that are beneficial. But when we look at the prebiotic, they are the fibers. So, for example, like oats, barley, leek, asparagus,
I've got a
onion.
picture of that. Let me just show you a picture of that. Keep talking, Martin. I've got a picture of that.
Yeah, and
Yeah.
or even fermented vegetables like sauerkraut or kimchi, if that is something that you enjoy. So this is
Yeah.
only a really brief list. Oh, fantastic, Wendy! It is fantastic. So these are the prebiotics. These are normally things that we don't normally digest it. Okay, now I do really need to keep to time, so I'm going to start answering some questions if it's okay. So first question: as well as osteoarthritis in both hands, I have Crohn's disease, so cannot take any anti-inflammatory drugs. What can I take for pain other than paracetamol?
Interesting. So pain is multifactorial, and it is not just due to joint damage. So
Yes.
pain, there are many contributors to pain, including anxiety, stress, bad sleep, many different things. So painkillers are often not the solution to, it
Yes.
sounds stupid, but painkillers are often not the solution to joint pain. It's about lifestyle management, which is obviously what Arthritis Action is all about self-management, and how can we create the right environment for that pain to be reduced in terms of stress, relaxation, sleep, mood, and so forth. Because basically, if you optimize everything else, pain will be less. So more painkillers is not necessarily the answer. In fact, NICE no longer recommend most painkillers for osteoarthritis pain for that reason.
I guess that
Exercise as well, of course. Exercise, of course, too.
I guess that using the term painkiller on its own is problematic, because pain is actually an alarm signal for our body. So I kind of like the term pain softener, so that you will be able to get on with the things that you would like doing. But then again, that will be another big topic for us to talk about.
Exactly, and of course, many the more drugs you take, the more adverse effects you're likely to have, and sometimes the side effect is worse than the cure.
Mm, mm. Okay, the second one. Since my mid-20s, I think, Wendy, you have answered this, during the webinar, but I'm going to, read it out again. Since my mid-20s, I'm now 55. I have suffered from constipation so much, so it become so severe at certain times in my life that it would become impacted. Luckily, now I'm on a daily dose of Morphical. I do have arthritis in different places. Do you think that this may have contributed to it, please?
Interesting. That's a very interesting topic. Again, constipation is multifactorial. Some people just have slightly slow gut transit time, but there is definitely a link between the time that it takes for you to eat something and for it to come out the other end, and the quality of the microbiome. So we're aiming for, when we eat something, we would like that to be gone within 3 days. So people that are very constipated may well not achieve that. The um generally that comes down to more fiber, would you say, Martin? And again, eating, if the more fiber we eat, the less likely we are to be constipated, and the healthier our microbiome will be. However, it's never too late. What do you think?
Mm.
What do you think?
And also more fluid as well,
Yes, absolutely, fluid.
increasing
And the
fluid.
reason that laxative is helping,
Yeah.
that laxative that's mentioned, is because it is what's called an osmotic laxative. And what an osmotic laxative will do is to suck water into the bowel and soften everything up. Sorry to be gross, but it will soften everything up, and it's easier to pass. So drinking more fluids can definitely help with that as well. So if you're having more fiber, have more water as well. Very interesting. They may
yes.
well be connected, but never too late to do something about that.
Mm. Can rheumatoid arthritis cause gastritis, or is it the medications, or both?
Interesting. Well, medications definitely cause gastritis. Obviously, anti-inflammatories, as I've shown, definitely cause gastritis. I don't think anyone knows the answer to that question. Gastritis specifically refers to inflammation of the
Or the gut?
stomach,
Yeah.
rather than inflammation of the bowel. But anti-inflammatories can also cause lower bowel inflammation lower down. I don't think anyone knows that yet.
Hmm. Okay, I've got an interesting one here. Please, can you give me some idea why rheumatologists and doctors avoid helping me with gut issues, and I have to pay someone when clearly RA is gut related?
Ouch, that's a delicate one, isn't it? Be
Mm.
careful with paying somebody, and be careful and make sure you know you're paying someone like Martin, who knows what he's talking about. I think it's because rheumatologists have 15 minutes to discuss things with people, and 15 minutes is not enough time to discuss diet. That's one thing. Also, it's a very not at all a well understand topic. So
Mm.
rheumatologists can't sort of say to you, go and eat this brand of bran flakes and you will be cured. They will say, perhaps if you take that medicine, your pain will be helped. So I think it's because, in our defence, it's because we are ignorant about this subject, as many
Mm.
people are. But
Mm.
I have read something recently, and perhaps I could put the reference out when we won't go on YouTube. But I've read something implying exactly that what we should be doing is looking at more lifestyle measures to manage rheumatoid arthritis rather than medication per se. So that's a recently published study. I'll
I
put that
guess
link
that
somewhere.
it is quite important for rheumatologists and dietitians to have a really good dialogue, because can always refer patients vice versa.
Yep, absolutely.
Okay, is there any connection between RA and diverticular disease, diverticular
Um,
disease and gluten intolerance? Sorry, I need to
um,
put my teeth back in.
yeah, that's diverticular disease. No, I do not think so with diverticular disease, because that
Oh,
is where
that's good.
diverticular disease, however, is caused by constipation, or often made worse by constipation. In diverticular disease, what
It's the
happens is
pouches
you get little
forming. Mm.
pouches forming in your bowel because there's too much pressure in there, and those pouches then will fill with what's meant to be expelled, and then that can cause local inflammation in the bowel. So, and again, that is directly related to the amount of fiber that we eat. There is no diverticular disease in some communities that eat a lot of fiber. It's a Western disease. Um, and the other one was gluten in gluten tolerance. So true celiac disease, which is an immune reaction to gluten,
Mm.
um, will strip the lining of the small bowel so that nutrients can't be absorbed. So that is celiac disease, and that, I mean, that is a serious medical condition that we clearly need to avoid gluten. Gluten intolerance, Martin, you would probably want to talk about that. Some people are definitely intolerant to gluten, but it's a complicated subject.
It is really complicated. I mean, like what you have alluded to, you got the true, celiac disease, but nowadays people tend to blame everything on on the gluten, on the wheat, and then that also gives rise to quite a lot of the bogus testing kits, where nine times out of ten they would say, yeah, you're gluten or wheat intolerant, but in fact you're not. So this is something that only proper skin prick test will be able to find out, and then and again testing for celiac is a medical procedure. So if you suspect that that's going to be the case, definitely speak to your GP regarding that, and definitely get it ruled out. And again, in the event of getting it really hard to get GP appointments, try and avoid them for around 3 to 6 months and see whether your symptoms has improved, because I think majority of the time it could be because your gut microbiome is out of whack, and that also causes a lot of bloating, because the different, maybe is the wrong type of gut bacteria decided to snap up quite a lot of the food, and then the byproduct, usually they are gas. Maybe you can have a look at supplementing yourself with a little bit more bifidobacterium, because they are one of the bacteria that you can find in yogurts like Activia, that can help to reduce bloating. But like most things nutritionally, you've got to stick with it for at least 6 to 8 weeks to see whether it's going to be helpful to you or not. So don't expect it, or don't be over ambitious and think that, oh, I start having my pot of yogurt, and why isn't it doing anything? Give it a little bit of time for the system to work. Right, okay, so I'm going to read out two more questions, and I do know that we have got a lot at the moment, and like I mentioned earlier, I'll definitely going to work with Wendy to answer your queries. Right, I am on long term. No, we have got okay. Let me have a look. Um, how do I? So how do we counteract the damage when we have no choice but to take certain medications?
That's a great question, because if you need medication to control your arthritis, you
Mm,
need it. I think it would the lifestyle things would be absolutely key there, and in terms of
yeah.
maximizing your gut health. So that would not just be by eating a certain diet, it would be looking at the whole picture. So it would be by reducing stress wherever you can, improving your sleep, avoiding smoking, exercising, avoiding alcohol if you can. Alcohol is pro-inflammatory, as I already said, or minimizing it. Don't feel guilty, as I said. So it's all about optimizing things that you can do. So controlling the things that you can control, in other words. So if you have to have drugs for your arthritis, continue to take them, but then just look at other aspects of your life that you can work on. We can all control our stress in a better way, can't we? What do you think, Martin? Anything else in there?
Yeah, definitely. I completely agree with you, Wendy. I just want to. I'm just seeing there's a message here, saying that we are advocating ultra processed food. I just want to make clear that we are not advocating it, and
No,
we
no, no, no,
definitely
no, no, no.
understand. Well, we understand that the downside of this, but make no difference in the world of nutrition. There are no black and white. Certainly a lot of the benefit come in the middle. So yeah, so make no mistake, we're not advocating the use of it.
We're not,
Right.
no, we're not advocating any kind of diet, a vegan diet, or avoiding meat, or
Yeah,
anything at
yeah.
all. Well, what Martin said was that if you want an occasional ready meal, that don't beat yourself up about it, because that's going to be fine. But if you're eating that kind of food every day, then clearly you need to be thinking about doing something differently.
Yes, definitely. Okay, so I'm really aware of the time here. So first of all, Wendy, thank you so much. Really appreciate for giving up your precious time to come on to this Arthritis Action webinar. And this is the end of our talk. So thank you so much for watching.